I'm Dr. Benjamin Meador. I teach in health sciences here at GSW. Here to talk about the new programs that we have. We have a certificate in exercise science and an endorsement in exercise physiology. So both of these are shorter programs. The certificate is 18 credit hours and the endorsement is 9. These were designed for people who are not looking to get a full bachelor's degree, but they do want or need some kind of background in the science of exercise. So people who are working in rehabilitation settings of some sort, so maybe a physical therapist, technician, working in wellness centers, corporate wellness would be a big one. Maybe you've got staff already who are running a wellness program for you, but they're not really versed in the actual background of exercise. It could also be people who are already in a health sciences field, but just don't have a background in exercise. For instance, even doctors, physician's assistants, nurses. They go through all this medical training, but they receive very little, and in some cases almost no training on exercise and how much we should be exercising. It's a bit of a problem in our modern landscape because we have only about a quarter of adults who are actually meeting their requirements for exercise. And when I say requirement, I really mean getting the amount of exercise that they need to maintain low levels of disease risk. So about 3/4 of us are so inactive that our risk levels are higher than they would be, right, or should be. And so we want people, especially in the health fields, people who are working in rehabilitation settings, wellness settings, gyms, we want them to understand how much exercise should we be getting. What should that exercise look like? What counts as exercise? If we just tell someone, well, you should exercise 30 minutes 3 times a week. What does that mean? Like, should I be walking? Should I be running? Do I have to be lifting weights? Right? How much of a disease reduction would we expect? What if I have diabetes or I have a history of heart disease? All these things are things that somebody who has a background or an education in exercise science would be able to answer. Right? So these are the types of things that our degree is built around. Give you that basic scientific understanding of what counts as exercise, how much do we need, how often, what's the intensity look like, why does it work, what is it about exercise that improves all these different things, and then we can go in 2 directions sort of on top of exercise, but what about performance? If we're concerned about running a race or training with athletes, that looks a little bit different than working with just a general adult population, right? So what do we change when we go in the direction of performance? And then another direction of what about disease? Somebody has cardiovascular disease, right? Diabetes, what if we're overweight? All these things. Those things modify, to some extent, our reaction to exercise. And so that's another whole set of physiology that we want to understand. Right? So both of these programs are designed to give you as much of that as we can give you without going through an entire bachelor's program. Right? So again, 18 credits for the certificate. In that, you'll get exposure to exercise physiology, which is just like the basic core science of what's going on in the body when we exercise. I'll talk about exercise nutrition, right? How do we modify nutrition for performance and exercise? Kinesiology, so the basics of kind of the physics of movement, what's happening to the muscles, what's happening to the joints, the loads, the forces, risk for injury, avoiding injury, all of that. And then we go into more the training side. Right? So how do we work with athletes versus average population? How do we work in disease populations? So we have different classes for if you're going sort of a rehab route, maybe working or headed towards physical therapy type of avenue versus heading towards something more like cardiac rehab, right? You'll see different things in those settings, right? Kind of more orthopedic injuries in PT, more sort of long-term disease concerns in cardiac rehab. So that's a certificate. The endorsement, again, it's an endorsement in exercise physiology. So we'll do the basic physiology, again, just kind of the core science of exercise. And then we add on top of that, again, what happens when we're really concerned about performance? What's the physiology of optimizing that? And again, with disease, what happens if somebody has cardiovascular disease? How does that affect how we would exercise them? Maybe they had a heart attack a couple weeks ago. Should we be exercising them? Maybe, probably. And what should that look like? Why should we do it? For more information, you go to the GSW website, and you'll find program pages for both the certificate and the endorsement, as well as the main exercise science program.